Good afternoon and welcome. It's so nice to see everyone introducing themselves in the chat. Thank you for joining us for the UCLA Pritzker Center's Pride Month talk, Safe and Supported, Harm Reduction, and Hope Amid Policy Change for LGBTQ plus youth in foster care. My name is Mia Yamamoto. I'll be a third year undergraduate student at UCLA this fall. I'm a research assistant at the UCLA Pritzker Center, and today I will be your co host along with our Policy and Community Impact Director, Nancy Olivares. Before we begin, we have a few logistics to cover. As a land grant institution, the UCLA Pritzker Center acknowledges our presence, digital or otherwise, on the traditional, ancestral, and unheeded territory of the Gabrielino Tongva peoples. We pay respect to the ancestors, elders, and relatives, past, present, and emerging. We are based at UCLA in Los Angeles, California, and we do our best to share information relevant to all jurisdictions, but please bear in mind applicable state and local policy. As always, we'd like to thank the Anthony Pritzker Family Foundation for its support in this event. This event is being recorded and it will be shared on our YouTube channel. Regarding questions, we will hold them until the end, but please feel free to put any of your questions in the chat and we'll log them. If time permits, our speakers will answer. Thank you.
Thank you. Thank you, Mia. We're so grateful to have you here as we come together to learn, to reflect, and engage in an important conversation about supporting our LGBTQ plus youth in foster care. We are pleased to host speakers who are working in different sectors to support and advocate for our LGBTQ youth. Our speakers will explore recent policy changes impacting LGBTQ plus youth, and then we will also review local resources and practices that help foster safe and affirming environments. Thank you again for being here, and I'll hand it back to Mia.
Thank you, Nancy. I'm pleased to introduce our first speaker, Elana Redfield, who is the Federal Policy Director at the UCLA Williams Institute. Elana, I'm turning it over to you.
Thank you so much, Mia, and thank you to Taylor, Nancy, and the Pritzker Center for inviting us all and having this conversation today. I'm going to talk about federal policy through the lens of evidence-based policymaking. What that means is basically making policies that are related to the kinds of things that are actually happening in the world as we measure through research and evidence, and trying to use our opportunities through the government to advance the well-being of communities. Next slide, please. I'm part of the Williams Institute, which is a research center at UCLA Law, and our focus is on LGBT law and policy. So we essentially look at the ways in which laws and policies affect the lives of the broader LGBTQ communities in the US and internationally. And really something that we're most proud of and we think is central to our mission is that facts and not myths or stereotypes inform what policy looks like. Next slide, please. So the Williams Institute, particularly my former colleague Bianca Wilson, who is a professor at UCLA now, have historically looked at the experiences of LGBTQ youth and system involvement, including foster care, as well as juvenile justice systems. Next slide, please. And Dr. Wilson put together this or led this project with many different researchers studying sexual and gender minority youth in foster care in Los Angeles. And that study was relatively impactful at the time. And we also did develop a research agenda looking at LGBTQ youth of color impacted by the child welfare and juvenile justice systems to try to carry that research forward towards the future. That was a few years afterwards. Next slide, please. In the study from 2014, which now is already 12 years old, Bianca found 19% of foster youth in LA were LGBTQ, and other things that helped us understand the real lived experiences, which, of course, young people experiencing these systems have reported forever, but that there was some real science behind it. In particular, there was evidence to show that LGBTQ youth have higher number of foster care placements, more likely to live in group homes, and are more likely to report being treated poorly by the foster care system compared to non-LGBTQ youth. So essentially, really putting hard evidence behind a lot of the work that everyone here probably is part of, and I know our panelists have devoted their lives to. Next slide, please. So from our perspective, we really want to improve data collection so that when California or Los Angeles or the federal government enact policies, they are based in fact on what the data show. Next slide, please. And so Dr. Wilson sent letters, regarding AFCARS, which is a system that is used to manage cases in the child welfare system by the federal government, as well as the many scholars at Williams Institute submitted requests to the federal government to basically adopt sexual orientation and gender identity measurement across all these federal systems to help have a better picture about what all LGBTQ people are experiencing, but particularly systems involved people and particularly systems involved youth. Next slide, please. And of course, we were able to get not just the Williams Institute, but certainly anyone who has worked in the area of SOGI data collection has been over the 20 years developing this whole research paradigm where federal surveys collect better and better data on our communities so that we can use that to study and understand them. And that includes same-sex partnership, same-sex couples raising children, income measurement, geographic measurement, housing security, food security, public assistance, the health of LGBTQ youth and adults, and as well as violence experienced by LGBTQ people. These federal data sources have been incredible, and they have been getting better and better until around 2025, if you can think of something that happened then. Next slide, please. And this also involved really investing in how we study and understand our population. So the Biden administration committed really deeply to better research and better policy based on research. Next slide, please. California also adopted a number of policies that allow for data collection on LGBTQ communities. Next slide, please. So we want to look quickly at the arc of federal policy over the past few years. Next slide, please. The designated placement rule was proposed under the Biden administration, and it would essentially require agencies providing foster care services to create designated placement status as an optional but not mandatory designation for providers of foster care. So specifically, different placements could opt into this designation by agreeing to a number of criteria that were essentially about making sure they were LGBTQ culturally competent, or culturally responsive, or culturally humble. Ideally, these placements were committing to a process of deepening and ongoing growth to make sure they were inclusive and supportive for LGBTQ youth. But it was optional, right? So this was really responsive to the data that showed that LGBTQ youth had more placements, were more likely to end up in group homes, and basically showing a need for these inclusive and supportive environments. Next slide, please. Recent developments, unfortunately, have gone in the other direction. Next slide, please. So President Trump issued a number of executive orders that essentially rolled back any kind of LGBTQ focused initiatives across the government, and also cut off grants that were being used to support LGBTQ inclusion programs. Next slide, please. So unfortunately, that included rescinding the designated placement rule. So, really quickly after it had been enacted, it was rescinded. And that's partly because of a case that was a decision issued in a case in one district court that held that it exceeded statutory authority and conflicted with the text of Section 4E. And so essentially this case could have been litigated to higher courts, but wasn't. The administration just said, we're going to cancel the whole rule based on this one lower court decision, which is somewhat atypical. Next slide, please. So this is all part of the mission to institute a very rigid understanding of gender and sexual orientation expressed in the executive order. Next slide, please. Unfortunately, this led to the removal of all the data sources I talked about before. They removed the gender identity data, and progress on LGBTQ inclusion in data has completely stopped. Next slide, please. Also, unfortunately, California has put a hold on some of its data collection because of the risk of the federal government potentially using those data to bring harm to LGBTQ communities. Next slide, please. think that's the end. So I want to end on this, that it's because we have data show such important things about LGBTQ youth in foster care, and because these federal sources are undermined for maybe years and maybe decades, it's so important for communities to engage in research and continue studying and continuing doing projects like the one that I started the presentation with. And there's a link that we have for a guide that the Williams Institute put together to really encourage community-based organizations and municipalities to study and understand LGBTQ communities. Thank you.
Thank you, Elana, for providing those insightful updates. I'm excited to introduce our next speaker, Yasemin Smallens, who is an acting researcher for the Lesbian, Gay, Bisexual, and Transgender Rights Program at the Human Rights Watch. Yasemin, the floor is yours.
Thank you so much. It is a real pleasure to be here today. Like you said, I work at Human Rights Watch. We are an international organization that monitors different human rights issues across the globe. I'm housed in the LGBT rights division, and I focus predominantly on the US. Last year, I published a report called They're Ruining People's Lives, which documented the real world harms of bans on gender affirming care for youth. I only have a few minutes, but it's a complex issue and it's, vital to the work we're talking about today. And at the center of this work is it started because in 2023, when we were, scoping out the research, only two countries in the world had enacted bans on gender affirming care, Russia and the US. And only one of those countries claimed to be a beacon for LGBT rights. And well, that was at the time. And that was the US. So we decided to do, a report, talking to individuals, family members, young people, and healthcare providers about the impact of recent bans on gender affirming care. The bans exist in 27 states. They're vague and sweeping in scope oftentimes. Some of them include aiding and abetting clauses, which means even facilitating, whatever that can be interpreted to mean. Gender affirming care can get healthcare provider or other officials in trouble. And some also include felony provisions for offering this care. Gender affirming care, for those who might not know, is a multidisciplinary practice. It is evidence-based and it is tailored to the evolving capacities of the child. Oftentimes, when I think about gender affirming care, I think of it as a gold standard of healthcare because it is a wedding of the social and the medical. When I talk to young people about, what was your experience receiving gender affirming care, they talk about going to a clinic and being met with a team of providers, social workers, mental health professionals, pediatric endocrinologists, supportive faith leaders sometimes, legal professionals sometimes, if those, services are needed. It is a holistic process, and in my mind, it is really a model for how healthcare should be. In contrast, these bans are blunt, sweeping in scope, and have had devastating effects on youth. Currently, 27 states have enacted bans on gender affirming care. Last year, we had a Supreme Court ruling in Skirmety, which upheld these state level bans. And in the time since, we've seen executive actions targeting this care intensify. We've seen the DOJ subpoena hospitals which currently provide this care. We've seen federal rules proposed to further restrict access. And we've seen, executive orders attempting to ban it nationwide. As a result, there's also widespread overcompliance with hospitals which aren't legally required to ceasing care because they're afraid of litigation or targeting by state or federal authorities. The impacts of these bans, as I mentioned earlier, are devastating. So we know that transgender and gender nonconforming youth are an elevated risk of, mental health, issues, and that can be for a variety of reasons. Some social, many social, in fact, especially in the current political climate. Last year, a report from the Trevor Project showed that there's a 72% increase in suicide attempts for youth who live in states with bans in effect. And that was reflected in our research. So we saw 7 reported instances of suicide in response to state level bans, 3 of which resulted in hospitalization. When you disrupt a child's access to gender affirming care, what's happening are oftentimes physical changes that they do not like, oftentimes substandard care, loss of relationships with trusted providers. You also see young people go from, finally finding a home in their own body to feeling like they have to withdraw socially and some skipping school altogether. This also places a strain on those who support young people, guardians and families. Some of them had to travel out of state, up to $4,500 every couple of months just to access care. Many lost coverage as a result of state level bans. And people are oftentimes missing work or school just to get healthcare that they used to be able to get at home. We saw some who also opted to relocate altogether, but of course that comes at a great cost, many of whom can't afford that. We also know in the state of Texas, there was a weaponization of child welfare services, which were ordered to investigate families which affirm young people who are trans. And these laws have ripple effects well beyond, just individuals and their families. We've seen healthcare systems writ large impacted. We see providers leave states which have enacted bans, fewer residents wanting to come to these states because they're telling us, why would I practice where I can't uphold my own medical ethics? And, these are states which need providers in many instances. And we also see hospitals having to invest more in security practices and for legal compliance and ongoing litigation. We're also seeing a care vacuum. So as these providers who are affirming as these gender facilities, which are, state of the art, holistic, really beautiful practices, no longer being able to treat their communities, harmful alternatives are rising in their place. People who are not well versed in gender affirming care, people who might be participating in things that could be considered conversion practices, now being able to operate where there are no longer gender affirming care providers. We also know these laws put a strain on shield states which still are able to provide gender affirming care for youth as more people from out of state are coming seeking their care. And we also know that in terms of overcompliance, we have seen adult access to care also heavily impacted as fewer and fewer providers feel comfortable at least, offering this care altogether, given aggressive actions from state and federal officials. In communities, we're also seeing youth feeling less comfortable to be out in public. I spoke to a number of community leaders who told me that their youth support groups saw dwindling numbers as bans were enacted and other forms of anti-trans legislation and policies came forward in their state. At the same time, we're seeing advocates have to flee for their safety and feeling fear about being seen public or speaking out. And again, the rising costs that we saw with hospitals in terms of security costs and service of litigation or legal compliance are also being forced onto community organizations, many of which barely had the budget to survive already. And it's worth saying these laws themselves also stoke misinformation and disinformation about a really small portion of the country, which are already thoroughly misunderstood. And, this is a talk about also hope. And I think it's hard to hold on to hope in these times and think about what change would look like. I can say, as somebody working in the human rights field, I do have a lot of hope. I've been spending a lot of time with trans communities, particularly in Texas, but also across the country. And the kind of advocacy I've seen is innovative, intersectional, and responding to the moment. As a mainstream human rights organization, I think a lot of our responsibility is to frame, the rights of trans people, the right to gender affirming care within a larger human rights framework, right? We're not talking about just trans rights here. We're talking about the right to bodily autonomy, the right to health, the right to privacy, and the rights of the child. These are fundamental human rights which are, protected under, federal law and also international law. And I think, understanding these rights within that broader context helps us build momentum to push back. We've been doing work at the state level, pushing blue states to do more to expand access to care for young people who are coming from out of state. We've been doing work at the national level of, submitting public comments, proposing, these rules which are seeking to restrict care. And we're doing advocacy at the international level as well. It's important to note that for a long time, the US was seen as a model for LGBT rights policy, how to be a more affirming country. And now we're a threat to LGBT rights globally. I think a lot of our work is to stop the bleed nationally and also internationally as other countries look to the US and look at how we are restricting access to this life-saving care. I'll stop there, but thank you so much for your time.
Thank you, Yasi. Now we're going to transition to some more strategies to combat these harms against LGBTQ youth. With the federal landscape in mind, we are going to turn to local and state efforts to support LGBTQ plus youth. Our next speaker is Lizzie Shuster from the Office of LA County Supervisor Lindsey Horvath. Lizzie is the Senior Youth and Community Wellbeing Deputy. Lizzie, I'll hand it over to you.
Great. Thank you so much. Thank you for inviting me to be here today and our office to be here today. We're really grateful to all the work that everyone on this call is doing to support young people in LA and across the country. So I have a bunch of things to share, and I'm going to share at a high level. If you have questions on anything, please let me know. And you've heard some of this already. So I guess I'll start. I wasn't going to start here, but we just heard about gender affirming care, and in Los Angeles County, our Board of Supervisors has passed a number of motions related to expanding access and pushing the federal government as it relates to gender affirming care. Recently, the board passed a motion to send 5 signature letters to the state to support bills related to gender affirming care, including AB 1854, 1930, and 2448. So we have been very clear that Los Angeles County stands for gender affirming care and have taken steps to try to combat what we're seeing nationwide. In 2024, the county established the LGBTQ plus commission, and this year they established an LGBTQ plus youth ad hoc committee. The goal of this ad hoc committee is to look at the 2017 scan that actually the Williams Institute helped perform of how county youth serving departments are serving LGBTQ plus young people and what we could do to better serve and support those young people. And so this ad hoc committee is going to be looking at that scan and going through the recommendations to see what still needs to be implemented and where we have work to do, particularly around training and staff development. As we all know, you don't go to one training and then you have all the answers. So how do we continue to work with our county staff who are working with young people to make sure that they are using the right language and supporting young people to the best of their ability? Speaking of, our Department of Children and Family Services has an Office of Equity now, and within that Office of Equity is an LGBTQ plus unit that focuses on making sure that we have services and supports available to our LGBTQ plus young people. DCFS has identified, I'm excited to share, DCFS has identified ongoing funding for this work and has worked with providers to offer tailored LGBTQ plus services and supports for young people. And so we've identified ongoing funding to fund this work. And I believe the contracts were just approved through next year. So we're excited. Those are countywide supports that are available to young people. Another program that Supervisor Horvath helped champion along with Supervisor Solis and DCFS is the Rainbow Resource Closet project, which I know you'll hear about from Elliott, so I won't say too much about that. But we believe that young people need to have a safe space where they can go to fully be their true and authentic selves. And we're very excited that the Department of Children and Family Services has identified funding to help expand that program countywide so that young people in foster care throughout the county have access to the gender affirming items that they need. And then I want to say 2 more quick things. The county, the supervisor, along with Supervisor Solis, passed a motion supporting the Press 3 option for the 988 suicide prevention hotline. As we heard earlier, we've seen a number of young people reaching out for support, and the federal government had taken away that option, the Press 3 option for LGBTQ plus young people. And so the county passed a motion supporting AB 1540 from Gonzalez, which would establish a California option 3. That bill is still working its way through the legislative process, but the county has been very supportive of it, and we continue to advocate for the restoration of option 3, which is the LGBTQ specialized line in 988. And we examined too what it would look like to have a local solution to this, but we are right now very focused on supporting AB 1540. And then related, but not finalized, is that in the latest budget, the legislative budget agreement included funding for the Press 3 LGBTQ plus option. So it looks like we may be coming up with a state solution in that space, which would be great. And then finally, Supervisor Horvath has been really supportive of gender-based violence work and thinking about how we can expand those services. And as part of that work, the county identified funding that was used in a community grants program. And so that money went out to community-based organizations in communities serving young people. All the grants had a prevention focus. So how do we prevent gender-based violence from occurring? And those grants included funding for LGBTQ plus youth peer leadership. And so the county was able to invest in community-based work to help support LGBTQ plus young people who are taking a leadership role in that space. I think overall, Supervisor Horvath and the board is very committed to doing what we can locally to support our young people in foster care, and in particular, our LGBTQ plus young people who we know are overrepresented in our child welfare system. And so, if there is more we can be doing, I invite you to reach out to us and share your thoughts. Like, let us know where we can be supportive. That's how we joined the Pritzker Foundation and Elliott in the Rainbow Resource Closet work. They came to us with an idea and we said, awesome, how do we help? So I invite you all to reach out to me, to our office, to let us know how we can be helpful to you all. So thank you. Thanks for inviting me to be part of this conversation.
Thank you so much for sharing, Lizzie, and for being here. Cindy Cruz, Director of Health at the National Center for Youth Law, is our next speaker. Cindy, can you share more about Nichols' Reproductive Health Equity Project for foster youth? We'd love to hear your thoughts.
Yeah, thank you so much. Hello, everyone. I'm Cindy. My pronouns are she and her. And I'm the director of REP, or the Reproductive Health Equity Project for foster youth at the National Center for Youth Law. You may also know us as NICL. So we are what we call a collective impact campaign, meaning we work with a wide range of partners. We started in LA County, so we have a lot of folks that were in partnership with LA County, but we've been expanding across the state. And as I mentioned, NICL serves as the backbone organization for REP. In addition to working with our partners, we also have a youth advisory board, which is really, really critical to our work. You can see them here pictured, some of them in our recent get together, but they are really critical to our work. Every year we hire about 15 to 18 young people with lived experience in foster care, and they are we work with them in all the projects that we do across REP. Our goal as REP is to ensure that youth in foster care have bodily autonomy and are able to achieve healthy sexual development. And we do this by working with youth directly through peer-to-peer resources, but also through working with the adults who work with youth in foster care, and be able to provide those adults with information, resources, so they can in turn be able to provide this information for young people and create the safe and youth-centered spaces that they need. Next slide, please. So I would love to highlight sex ed as one of the ways that we work to ensure that health education and resources are gender inclusive for LGBTQ youth in foster care. Very briefly, California has legislation in place to ensure that all young people receive inclusive, comprehensive sex education that is affirming of LGBTQ youth, relationships, etc. And this was passed in 2016. However, we quickly realized that youth in foster care, because they are a highly mobile population, often missed sex ed in school. And when we talked to young people, they told us, I came in after sex ed was offered in my school, or I left that school before it was offered, and they were likely to fall through the cracks. So we worked to pass legislation in 2017 to ensure that social workers were working closely on documenting, ensuring that youth in foster care were receiving sex ed in school. And if they weren't, that they were connecting them to a program in the community where they were able to receive sex ed that was aligned with the California Healthy Youth Act, meaning it was inclusive and comprehensive. After this was passed in 2017, though, we realized there weren't any programs in the community that were actually that social workers could connect young people to. So we worked on what you see here, Teen Talk Foster Youth, which is a virtual sex ed curriculum for youth in foster care. It's specifically tailored to them and their needs. We worked with young people, sex educators, healthcare providers, lawyers, etc., to adapt this curriculum specifically for foster youth. And we work with a variety of community partners to implement the curriculum. And we've worked with several partners, including DCFS, to be able to connect young people, but also ensure social workers are aware that they can connect young people to this program. So yeah, we do a lot of work on Teen Talk Foster Youth and sex ed in California. And next slide, please. And a couple of other resources I'd like to highlight today as well. As I mentioned, we have a lot of resources that are for the adults working with youth in foster care. So today I wanted to highlight a brand new campaign that we launched a couple weeks ago called That's Inclusive Care. This campaign is specifically highlights healthcare experiences of youth in foster care. We talked to a lot of young people. A lot of them say, I didn't go to the doctor. I had an experience that wasn't affirming of who I am, or my doctor questioned me. My doctor had a lot of stereotypes about me. And so this campaign highlights examples of healthcare that has felt inclusive to young folks and healthcare that hasn't felt inclusive. A few years back, we did some work with healthcare providers and young people, and we put out a toolkit called the Foster Friendly Healthcare Toolkit. And that toolkit is again, geared towards providers and ensuring that they know how to provide healthcare that is inclusive and centering of the experiences of youth in foster care. Next slide, please. And another resource I want to highlight today is our Caregiver podcast. So this podcast was created for caregivers to help support the conversations around healthy sexual development with the young people that they care for. And so we worked with resource parents, caregivers, young people. A lot of our youth advisory board is highlighted in our podcast and featured in our podcast. And we have several episodes that are specifically around how to support LGBTQ young people. So it's a really great resource. And I will say, even though it's geared towards caregivers, even if you're not a caregiver, but you are an adult working with a young person in foster care, this is a really great resource. You'll learn a lot. And we also have a youth podcast. So if you are working with young people, check out our website. Self-Taught is a podcast that is a peer-to-peer podcast specifically by young people for young people. Also a really great resource. And next slide, please. And before I leave, I want to talk a little bit about surveillance, safety, and visibility for LGBTQ youth. You've heard Elana talk about data. This is something we're also keeping our eyes on, data and the safety of young people in LA County. We know that data is collected to, or SOGI data is collected to ensure affirming care and safe placements. But as we've heard, that could be really dangerous if that data is in the wrong hands. So that's something we're keeping an eye on as Nicole. Also, our litigation team is contributing to amicus briefs in cases involving forced outings in schools and parental rights, and analyzing the impact of those cases on youth in foster care. And last, but not least, I will say in our work with our youth advisory board that we do with communications and narrative shifting, we also work with young people to ensure their safety as they're sharing their stories and their experiences, and making sure that we are keeping them as safe as possible as we're advocating and they're advocating as well. And I will end there. Thank you.
Thank you, Cindy, for sharing those valuable resources. Next, I'm excited to introduce our next speaker, Elliott Hinkle, Principal and Founder at Unicorn Solutions. Elliott, can you share about the Rainbow Resource Network?
Yes, of course. Well, thank you for having me. Thank you to the Pritzker teams for inviting me and all of us to share today. I'd love to talk with you all about the Rainbow Resource Network. So this is a project that has been youth-led by youth and for youth with some incredible partner agencies, some who are on the call today. And we do a presentation for folks that you are able to reach out to me to get. That's an Ask Me Anything training from Closets to Confidence, helping LGBTQ plus youth feel seen and safe, where we pop in for 30 minutes or less and are able to answer questions and talk about this resource. And the biggest place, of course, that we've been helpful, I think, is demystifying gender-affirming items for people and just introducing them to folks so they can ask questions and feel better supported to support young people in accessing them. So we can go to the next slide. So this network, the bottom line is that it's a network of affirming clothing closets for LGBTQ plus youth with universal access to those gender affirming items, so not just clothing, and links to community and supportive services. The goal being that they have access to gender affirming clothing as well as safety, dignity, and joy at no cost. So it's primarily for all current and former foster youth in LA County with a particular focus on our transition age youth who are non-binary, trans, or LGBTQ plus. And there's currently actually 4 partner organizations hosting closets across LA County. So we can go to the next slide to see who those are. So LA LGBT Center has more than one closet now. And so you'll be able to go there and get free clothing if you're a young person. You can just go and show up as long as you look for their open hours or contact them to schedule an appointment. Village Family Services as well. Alexis Project VIP and Penny Lane centers are coming online, and there's been an RFP with the county, and so we will likely see more of these spaces come to fruition in LA County. Next slide, please. So when folks come to the closet, our hope is that they can expect to find closets are walk-in setup, whereas some are by appointment, but usually there's some version of a hybrid there. They're youth-centered environments that are trauma-informed, so staff and volunteers help assist them with shopping, but again, everything is free. There's no cost, and there's not necessarily a limit on what they can take. There's clothing and hygiene products and even safety items. If items aren't in stock, they can usually request that from closet staff, and youth will go through a simple intake form. They don't take any personally identifiable information, but things like shirts, t-shirts, how many are going out the door. Privacy considerations, like where the closet is located, is definitely stuff we want folks to keep in mind. Who else might be going to that closet? And if the young person wants to go with their worker or on their own, they don't have to go with their foster care workers. They can go on their own. And then coordination with caregivers, we just advise folks to be thoughtful about if it's safe and appropriate and with the youth's consent to inform affirming caregivers. But youth, again, do not have to have permission to come to this closet. It is free for them to come to any of those spaces. So we invite them to do so. Next slide, please. One thing we try to offer and sort of emphasize with this project has been consent and autonomy, that young people should have control in and how and when they access the Rainbow resources. And we also want to ensure that workers and anyone else working with them don't out youth in the process of making referrals or transporting them. It can be a really exciting and joyful thing to bring youth to the closet, and that excitement can sometimes turn into oversharing about Joey's finally going to the closet. But Joey might not want everyone to know that. And so we want people to be thoughtful about connect people to the resource, but still give them confidentiality in doing so. Last slide, please. So if you are curious to learn more about the Rainbow Resource Network, or you think that your organization might want a quick free training about what it is and how to access it, you can reach me at elliottunicornsolutions@gmail.com. In the chat, there's also two resources. One is the actual Rainbow Resource Blueprint. That's the PDF that's available on my website. So you can learn how to create a gender affirming clothing closet like we did from beginning to end. It also gives a shout out to our youth ambassadors, our partner project organizations who really helped to build this and make it possible. Certainly a big thank you to the Anthony Pritzker Family Foundation, Casey Family Programs, our youth ambassadors again, and the LA Board of Supervisors who really just made this project happen and has created something joyful. So if you're looking for joy, it's a positive space to go to. And then one last plug is the other link that was shared is for Visible and Unstoppable. That's a national event happening virtually next Tuesday. If you're looking for a positive way to end your Pride Month, potentially with joy or maybe even happy tears, that's a great thing to tune into. It's from 8 to 2 p.m. Pacific time. It runs that whole time frame. You can hop on and off. You can tune into the YouTube and go there to get Unicorn Solutions LLC YouTube to find the live stream without having to sign up, or you can go to the link here to sign up to the Zoom webinar, and that will give you an opportunity to be a part of the webinar conversation. When you look at the website, though, you'll see that there's speakers that range from across the board. Last year, we had some of your California state representatives. We had Dennis and Judy Shepard, just had a variety of people. And then this year, we'll have some youth and families. We'll actually have somebody from Cindy's project that'll come and speak. So we're excited to have them. So please come tune in if you're just looking for something positive and joyful in the world for queer youth and families to understand that actually people have not all turned their back on them. And there's a lot of us still fighting for them and for their support. So a big thank you to Pritzker folks for having me. And if you need anything, feel free to reach out. Thank you so much.
Very joyful and inspiring. Thank you for sharing, Elliott. Lastly, I'm excited to introduce Ariel Bustamante. The LGBT Center is always at the forefront of advocacy and support for LGBTQ youth. Ariel, the spotlight is yours.
Thanks, Mia, and thank you everyone for joining us today. Really happy to round out our conversation talking about some of the direct services that we offer at the center that you can connect young people to, along with many policy advocacy initiatives we have at the local, state, and national level. On the next slide, I just want to showcase some of the incredible folks that we work with. And I just like to showcase the joy, the resilience, the happiness within our community. This has been obviously a heavy session and we are in really heavy times. And it's really important that we take a moment to also understand that the work goes on and that, especially queer and trans young people and the families that support them are doing wonderful, beautiful things. And so these are all real staff, volunteers, and clients of the LGBT Center's space. On the next slide, I'll share with you just a little bit about the center. For folks who aren't familiar with us, we are the world's oldest and largest LGBTQ plus organization in the world. Every single month, we serve over 50,000 clients across all stages of life. And really any service you can think of, we offer. Healthcare, legal services, housing, you name it, we offer it. But what I want to dig into is some of our youth services, which is on the next slide. And when we think about our youth services, we kind of put them into four main categories. Our youth services are designed for young people 24 and younger and are based in our Los Angeles area locations. So our youth center is at our headquarters in Hollywood. It's open 7 days a week, and that is really sort of an access center point for young people experiencing homelessness who may need crisis services like housing, shelter, food, hygiene, etc. But that's also sort of the main hub where folks can get connected. I want to just emphasize that we have a no wrong door approach, and all of our services are low or no cost for young people. All of our services are no cost. We never want, economic circumstances to be why somebody doesn't access best practice medical care, really high quality housing, you name it, right? We want to make sure folks have access to that. So folks can go to any of our 9 locations throughout Los Angeles and get connected to our youth services and other services. From the youth center, we move on to our youth academy, and that's really what I like to think of as our dreaming space. Once we've addressed some of the sort of initial primary needs of young people, we're able to start digging into all the additional things that they want to think about for their future. whether that's their education. Do they want to complete their GED or get their high school diploma at our on-site high school? Do they want to get connected to a paid internship program where they can complete training in culinary arts, social services, or any other sort of career path that they're interested in? And do they also want to connect with peers through our youth development programming, whether it's social support groups, hobbies and interests, you name it? Again, we try to offer a huge array of things. And I genuinely invite any of you who might be in the LA area or come to LA to come by for a tour, send me an email. We would love to showcase the space and get you better acquainted. I know for the service providers in the space, it's so much more meaningful to see exactly where you are sending your clients rather than just trusting that this is a reputable organization. We also have our residential programming, and so that includes everything from emergency overnight beds all the way to permanent supportive housing. And so really making sure that young people experiencing homelessness ages 18 to 24 are connected to safe housing options that also set them up for permanency long term. And last but not least, our community-based programming. We have a whole host of services that work with young people who are at home, in school, or otherwise not connected to the center's services on site. And in particular, that includes young people in the foster care system. So on the next slide, I'll just highlight our involvement with the Tailored Services Program. Alongside Penny Lane, we are currently the two providers of the Tailored Services Program through LA County DCFS. The center provides services in spas 3, 4, 5, and 6. And this is a really incredible program at the center. We call it RISE, and it's been around for many, many years. And this is really that wraparound model. Again, young people, caregivers, extended family, chosen family are all eligible to get the support that they need. And it connects them to all those wonderful things that we've heard about that are really necessary for young people, not just to survive, but thrive. In particular, on the next slide, I will just highlight that aside from getting connected to all of the center's services, that also includes our Rainbow Boutique, which is the name of our Rainbow Resource Network closet at the center. This is the name that the youth ambassadors from the center came up with. And we currently have two brick and mortar sort of permanent locations, one at our headquarters in Hollywood and one at Center South near Leimert Park. And as Elliott mentioned, more locations are popping up. We're working with a number of different organizations like Somos Familia Valle to be able to add locations that are more accessible to young people. The other thing I'll mention about all of these services, especially things like the Rainbow Resource Network, is they are very fluid as far as making sure that that universal access approach is lived up to. So if we have young people who are unable to get to a location, we mail them items. We get on the phone with them if they need to. We've had caregivers who are so sweet and have reached out and said, I have a young person in my life who's just come out. I have no idea what I'm doing. Can you support me? And we make that happen. We've had siblings and friends who reach out and say, a classmate of mine is transgender and needs a binder, but they don't have access to that. Can you help us get that? So we really do everything we can to make all of our services and programs as accessible as possible to folks. The last couple of things I want to talk about beyond our direct services are some of the things that we're doing in the policy advocacy space. So that'll be on the next slide, I believe. I want to highlight, and I can't remember who said it, but just, again, this is a time, as much as it has been difficult, as much as there's so much more work to be done, it is not all doom and gloom. And so I just wanted to highlight a couple of wins that we've had in the past year or so, just to showcase that, again, there has been some progress. Yes, we've also had a ton of setbacks. At the same time, I do have a lot of hope in the power of community and in the organizing that all of us on this session and our organizations are doing. So one of those things happened about a year ago in June, and that was when 9 LGBTQ plus and HIV prevention organizations across 6 different states filed a lawsuit against the administration, challenging the implementation of 3 anti-trans and anti-DEI executive orders, and they were successful in getting an injunction on that. Last August, 15 state attorney generals formed a coalition to protect gender-affirming care for transgender youth age 19 and under, and that does include California State Attorney General Bonta, who just also, if you look up, or I'll see if I can find the link before we hop off, issued a statement around this. In October, California passed 9 new laws protecting LGBTQ plus Californians. And in November, the California Supreme Court rejected the free speech challenge to LGBTQ plus protections in nursing homes, which means that folks that are in long-term care facilities have access and have the right to non-discriminatory care. So those are all wonderful wins for our community, despite, the challenges that we're hearing about. So if you're wondering how to get involved, what to do next, I'm here to kind of close out with that. One of those opportunities is on our next slide, and that's through training and technical assistance. I think Lizzie mentioned, right, that, training is so important, coaching is so important, but what's also important that those things are sustainable. And at the center, we offer free training and technical assistance to organizations. If any of you are California-based, we can offer trainings locally or virtually to you all anywhere in the state of California, and would love to be able to come and provide some training for you, whether it's a customized module that fits your agency's specific needs or as one of our sort of ongoing offerings. We also house the National Institute on LGBTQ plus Intimate Partner Violence. They have done some incredible work and have particular modules at the intersections of queer and trans folks and intimate partner violence. So there are so many offerings for you. And if training and technical assistance isn't your jam, or you're wanting to sort of, get more action based, on the next slide, there's a couple of other opportunities. One of those opportunities is through our Out for Safe Schools and Spaces program. Each year we publish a toolkit that really gives sort of mobilization, tips, tricks, laws, policies, lots of really juicy information for folks who are caring about young people in schools. We know right now that schools in particular are a hot spot for attacking trans and gender nonconforming, intersex, and non-binary young people, especially around sports access. And so this toolkit is from our 2025-26 school year. Stay tuned for updated resources, but this is just one way to kind of, dip your toes in if you're wanting to get mobilized and get, active. We also have our Models of Pride conference and event that happens every single October. So save the date, Saturday, October 10th, we'll be offering that incredible part festival, part, workshops and conferences event. On the topic of joy, you will never truly see that many LGBTQ plus young people in one particular place, let alone just beaming with excitement to be able to go to the college career and resource fair, go to really fun workshops. And also you're going to see parents, caregivers, professionals like all of you who are there attending workshops dedicated to you and your growth, all of which is free. So I hope that many of you will join us on Saturday, October 10th. Last but not least, on the final slide, I will just share that these QR codes, which will be made available afterwards, are some additional ways to get involved. The first link is our one-click action alerts. And so these are really quick and easy ways to understand some of the policy areas that we are paying close attention to. And in under 5 minutes, truly like probably close to 60 seconds to 2 minutes, you're able to look at those one-click action alerts, fill in your information, and send a note to elected officials. We also have our policy newsletter if you're wanting to stay in touch and learn more about our policy advocacy efforts. If you're in the Los Angeles area, we are conducting canvassing efforts in the San Gabriel Valley to reduce anti-transgender bias. And that's something that happens on the weekends in the Monterey Park area, and would love to have you all join us. And then, as I mentioned, the training and technical assistance we have, and y'all are welcome to reach out to me for more information on how to get us at your agency. The very last slide has my contact information along with some additional resources and the slides here. And thank you so much for letting me share a little bit about some of the stuff happening at the center.
Ariel, thank you so much for the presentation. We have one question regarding housing, asking, is the LGBT Center the only place that would provide housing or THP options on this call? And if so, are there other recommendations that you have relating to housing for LGBTQ youth?
It's a great question. I'm going to answer that question, and I'm also going to mention about access to gender-affirming care, because I know that might also be on folks' mind. So we are part of the LA County Coordinated Entry System. We are the SPA 4 youth lead, but there are dozens of agencies across LA County that provide housing for youth experiencing homelessness. And if folks are struggling to identify a provider in their particular region that might be safe and affirming for young people to go to, we can definitely troubleshoot that that with folks. I'm sure there's others on this call that also have housing options. Some of the other folks that we often refer out to are spaces like SPY, Safe Place for Youth, and SPA 5, Youth Emerging Stronger, which also provides housing, I believe, for younger youth. So there's so many different providers across the county. Ours oftentimes is the go-to because we have LGBT in the name. Young people are coming not just from the local region, but sometimes even out of state. So hopefully that answers that question, and folks again can reach out to me. Regarding gender-affirming care, our healthcare services currently only offer gender-affirming care to folks 18 and older, but we do accept all insurances other than Kaiser. For folks who are looking to access gender-affirming care for minors, if they have Medi-Cal or have an open foster care case, they can go through LA County Department of Health Services and their Alexis Clinic project that was referenced in Elliott's presentation. Also, Prasilio Care is out of Pasadena. Dr. Joe Olson, who was the provider at Children's Hospital, has a clinic in Pasadena, and they are expanding their insurance options as well. So that's a great option for folks who have private insurance.
Wonderful. Thank you, Ariel. We'll turn it back to Mia to close us out today. Thank you, everyone.
Thank you so much all for joining us today. We appreciate any feedback or questions you may have. There is going to be a feedback form in the chat. I'll drop it right now. Sorry. And please follow us on social media at UCLA Pritzker Center or visit our website. You're also welcome to contact us with any questions, and I will drop our contact information below in the chat, and you can also see it on our screen. Thank you so much for participating in the webinar. We will follow up to share the slides and the recording. Thank you for joining us.